My name is Ezekiel Oburu. I'm an orthopedic surgeon at the University of Nairobi. And today we're demonstrating various casts that we use. We are now showing casts of the lower limb. And the next video we will demonstrate how to put a below knee posterior slab cast, or also known as a back slab really in many circles. We have Cynthia here. Thank you very much, Cynthia, who has agreed to be our model and our patient for today. And we have Zach here, who is an orthopedic trauma technologist, who is going to be demonstrating how to put the cast. So over to you, Zach.
Yeah.
Before Zach starts, I just want to say some of the indications. Number one, patients who have ankle fractures or who you want to rest because there's so much swelling and you want to avoid the issue of putting a full cast, circular cast initially in the first week. Or some patients we commonly use it in patients who had hind foot surgery. So whatever ankle fracture surgery, you fixed the ankle, or you've done any form of hind foot surgery, you've fused the ankle, or you've fused the subtalar joint, or you've done a triple arthrodesis. This is the first cast you put before you put a circular cast, because this allows the limb to swell without any complications of compartment syndrome. So Zach, I'll let you go.
Yeah, thank you. So we are going to apply a below knee posterior slab or a below knee back slab. For the lower limb, still positioning is very important when you are doing especially the lower limb injuries. So you can see our patient, she's on a table or a couch. Yeah, as long as it's raised, then ensure your patient there is that hanging, because we want that gravity. That gravity is very important. The hanging of the foot is very important. So when we are applying a below knee posterior slab, we always measure posterior slab there, and then now we are going to have another U. It's called the U, or called stirrup. It's called the U slab. So, or we can say the medial and then the lateral, then the posterior. So it gives more stability and more immobilization. So what do we need when we want to apply a below knee posterior slab? Of course, our materials are very important. We'll require our crepe bandage of various sizes, especially 6-inch. Then, very important, stockinette is also good to be able to apply, to be able to see the stockinette. So we normally measure and give it all the way there to be able to see this. Then the orthopedic padding is very important. Then being able to measure my two slabs. I've been able to measure the two slabs below the posterior slab. So we have the posterior slab, this one, and then now we have the other. For the lateral and the medial, it's like a U slab. So what we start from stockinette. Basically, stockinette should be having various sizes, small, medium, because you'll be seeing various patients. So we have the small, the medium, and the large. So having applied this soft band, the stockinette is the first one to be applied. Then we have our soft band. Very important still, applying 50% overlap. So don't tie it just the way you apply the other ones. Remembering, don't go beyond because of the peroneal nerve at the head of the fibula. Then ensuring those prominent areas, we want to make sure that we secure. So just cutting a small piece, then another piece. So for this piece, we are going to apply at the heel, coming all the way there, and then the other one at the malleoli. These are called the medial and then the lateral. Very important for those prominent areas of the bone. It's good to secure. So having ensured that you've applied your soft band, both areas you've been able to secure, and then now we get the posterior. Basically, we get a posterior slab. So when you make sure that you are dipping it. Basically, when you're applying like the lower limb, you can actually be able to apply like 8 layers or even 10 layers. So Then, because you need to give a stability and the strong ones, give like 8 to 10 layers. So let's dip it. So, because I have my assistant. Thank you. So for this, you're able to apply this in here. This procedure, you cannot be able to do it alone. You always require 2 personnel, or sometimes you can actually be able to require even 3. So for this, okay.
You can hold this.
Okay. Yep. Yes. Yeah, so you bring it. Then now you secure with a clay bandage. So we need to secure with a clay bandage. Using around 6-inch, just the way you use also the plaster of Paris slab or bandage, you use the 6-inch, especially when you're doing the lower limb. And particularly the below knee posterior slab, 6-inch is very important. Then you can fold actually, because of the, you can appreciate the stockinette. It gives a nice, really finishing. So get another clay bandage for continuity. Still the same clay bandage. You apply using a 6-inch. So at the toes, you're able to expose it because of need to be able to monitor. So after applying, maybe the second or third one, give it firm. At least now you've applied the first, the second, now the third one, you can make it now firm. Ensuring 50% overlap. Making sure that maintaining your foot or your ankle should always in a neutral position. Then you can actually be able to secure now the last edge with a clay bandage. So that is a below knee posterior slab. Basically, it's especially supposed to use crutches, clean, wipe, give instruction how it's supposed, because this is a swelling, you know, this is an injury, because injuries around the ankle joints are prone of swelling. So we normally encourage the patient to be able to elevate and exercise throughout because of the circulations. Then you can actually be able to follow up this patient until you're able to give it a definite treatment. So this is actually temporarily, or even some of the cases can actually be able to even to be.
Yeah, that's true. Yeah, usually it's temporary, especially the ankle fractures. But remember, we said in surgery that may be what we'll use initially. So you really must be able. The extra straight up sometimes provides even better stability. Okay. Just one point of note: when you put the extra straight up, it's just on the side. Don't make sure it doesn't come right to the front, otherwise it's more constricting. All right, thank you very much.